Well, the Ohio Commission of Minority Health was the first commission on minority health in all the country. It was set up, almost over 30 years ago, and now there's their commission on minority health in like 47 out of the 50 states. And so we really were trailblazing in terms of, just looking at the issues that are problems. I mean, it's like when you think about patient-centered care, we don't give smoking cessation counseling to people who don't smoke, right? It's a waste of time. We only do that with people who smoke. And so they have the problem. And so with the Commission on Minority Health, it really sort of unveiled that these disparities exist. A lot of times people don't think they think it's, people made it up. The disparities exist. And then what are the reasons? The reasons aren't all they're not taking care of themselves. It's not all they're not eating right or they're smoking. It's not all that. There's parts that providers play in contributing or sustaining health disparities. And so the commission, of course, was concentrating on everything: educating patients, educating the hospital systems, and then also, trying to see what we can do with providers. But as a physician, when I became the chair, of course, mine was specific to, what can we do? I can't change poverty, right? I'm not able to do that because I'm a physician. I'm not a politician, or job creator, right? And so, in order to not have the frustration of, of not being able to do anything, I said, well, what we can do is sort of impact, educate providers about what they can do about it. And again, cultural competence was sort of a bad word, in some circles. I don't want to be made to learn about, I don't want that. Right. No, but what you can do is learn what's going to make your life easier, what's going to make your outcomes better. So the Commission on Minority Health, Ohio Medicaid has an advisory board. Again, it just tries to advise, providers and provide advice to them on what's going on the ground in our doctors' offices. And so I felt when the opportunity came to be on that committee, I thought, this is important that they know, because a lot of times I would find that they would do something that didn't really make sense. And it wasn't because they wanted to do something that didn't make sense. It was because maybe they hadn't asked someone what, a provider, what makes sense, right? And so we've had opportunities to talk and sort of give a perspective when we meet. Again, we meet quarterly with Ohio Medicaid, and they're very responsive and very, very open to ways to save money. Medicaid spends a lot of money. And so if you could save money by having people do better, by having, shorter hospital stays and get well better, I'm saying you get well faster, that saves money. If we can control people's blood pressure on medication, it saves money for heart attacks, strokes, heart failure. We can get people to stop smoking. That saves, get them to cover smoking cessation medications. That saves them money, down the road. And so it's been a great opportunity to sort of work with them. And I'm on the Cuyahoga County Board of Health, and that's just, they needed a physician on the Board of Health, and I've been on it for over 10 years, and it was, it was just, they're a great organization. It was fun. And then COVID hit. And what's funny is I got elected chairman in January, and then COVID hit like in February. And so it's been a job, and all the dynamics associated with that. But it's been rewarding. We're still trying to get through. We've got another variant kind of coming through now, but it keeps sort of my eye on the ear on the ground to see what's going on and what's next, and try to leave the place a little better than we found it.